The next slide we're going to talk about is stakeholder analysis. So a stakeholder analysis is a process of identifying these people before the project begins, grouping them according to their levels of participation, interest, and influence in the project, and determining how best to involve and communicate each of these stakeholder groups throughout the project. So it is important to have a clear understanding of each stakeholder and what they are expected from the project from the start. So here on this slide, we can see the different stakeholders followed by each category that describes how the project would be delivered. So here, the first stakeholder will be the patient. The second one is the nurses. And the third is the management. So for the patient, we want to make sure that they are kept in a safe and clean environment free of related device infections. For the needs of the project, from the needs from the stakeholder, we want the patient's agreement on the insertion of the catheter and to participate in the care of the Foley catheter. The perceived attitudes and risks associated with the patient would be that the patient may refuse the insertion of the catheter, or some patients may ask for a Foley placement to keep them from getting out of bed. And then the actions to take would be that we should educate the patient on the necessity of the catheter and the importance for maintaining proper care. The next stakeholder would be the nurses. So the requirement for this project for nurses would be that they are to maintain proper care and continuous monitoring of the Foley catheter. The needs from the stakeholder would be that the nurses must participate in training programs to assist them on how to properly care and insert the Foley catheter. Their attitudes and risks associated with the stakeholder would be that some nurses may not be consistent in maintaining care of the catheter due to the excessive workload from other patients, as well as non-adherence to hospital policy. The actions taken would be to organize meeting sessions with nurses to discuss concerns and solutions to resolve further issues and to increase patient safety. The last stakeholder would be management. So the management will be required to provide available resources for nurses to assist them on how to properly care and insert Foley catheters. The stakeholder will need to be supportive and committed to help address the issues nurses may have on how to properly insert and care for the Foley catheter. Their perceived attitudes and risks will be lack of effort to inquire for training programs or other forms of assistance due to cost, and they overall want to be supportive of the patient's safety. Actions taken would be that the management must provide financial resources such as training programs to help educate nurses and to ensure the safety for all patients.